Can you tell me a little bit about Intracept and what it is?
The procedure is really quite amazing. It's a permanent procedure.
So you're really nailing the exact source of that pain.
Correct. So Intracept's relatively new, I'll say probably less than 10 years or so. So basically this treatment is targeting what's called the basivertebral nerve. Okay, this nerve actually lives inside of your vertebral bone in the front part of your spine. To date, we've had very little treatments for this anterior column type pain. And I remember in fellowship, we talked about discogenic pain, pain that originates from the disc. And this is pain that's worse with movement and activity. So these people are like, look, if I'm I'm laying down or sitting still or not doing something, I'm fine. It's like I go to pick something up or do some repetitive. And it's very, very, very painful. But it's usually worse with like forward bending and things. But it's a result of degenerative changes in the disc that then cause changes in the bone itself and irritate that nerve. We have to have an MRI to see those changes. I think you could argue that you could probably identify those changes on X-ray, but insurance requirement is MRI. And you'll see changes in the end plates of those bones, okay? We call those Modic changes. I think that was the guy who first discovered them. It's really quite amazing. It's a permanent procedure, okay?
Okay.
We take a port, we access the area of the nerve from the front of that bone using light sedation here in our surgery center. It's not a terribly painful or uncomfortable procedure for most folks. You put a heating element next to where that nerve is.
So we're going inside the bone through a port.
Correct.
And then we're heating the nerve.
Correct. And you're creating a lesion around that nerve to destroy that nerve.
Wow.
Okay. So this is a permanent type treatment.
Is this similar to like an RFA or?
Similar in the fact that it uses radiofrequency and a heating type procedure to destroy the nerve, but it is a permanent burn. That nerve's
not coming back.
Not coming back. Okay.
Wow.
So it's phenomenal, and we've seen patients.
So everybody that doesn't know, like an RFA, typically the nerve's coming back in 6 to 12 months.
Correct.
So okay.
Some people get more or less than that, but that's
Yeah.
pretty standard. This is a permanent destruction of that nerve. It's only responsible for that. It doesn't do other things, so we're not worried about causing any sort of paralysis or permanent kind of problem. And our patients who have not had any luck, these are patients who have tried everything. I did epidurals, it didn't help. Maybe it helped for a few days. I did an RFA. It helped some, but not totally. It's because you're treating like a different type of pain, a different location of pain.
So you're really nailing the exact source of that pain.
Correct.
And this is disc type pain.
Yeah, this discogenic, like degenerative disc type pain.
And they've tried epidurals, they've done all this stuff. Maybe they've done decompression, maybe even a mild. This is like what we're doing as a final thing.
Yep.
Okay.
It's such a permanent type procedure that insurance will not let you go back and do it again at that level. It's already been done. Nope, it's been done. You can't go back in there and do that.